As COVID cases climb, our local hospitals are filling up. Those numbers: 127 patients, 37 in ICU, and 29 on ventilators. As a result, Billings Clinic announced today that it is preparing for crisis standards of care. That means some tough decisions about which patients will be treated first and how limited resources will be used. Q2's Janelle Slade has more.
Our ICU is at 150% capacity.
Emergency room physician Dr. Nathan Allen says the number of COVID-related patients has nearly doubled in the last 2 weeks.
And we've been in a constant process as the hospital of opening up a new overflow unit, which is then filled, and then a new overflow unit, which is filled.
Physical ICU is 28 beds. It's at capacity, so we've had to surge our ICU level patients into other areas of the hospital.
Here's a great example. We're now in the emergency department where 14 of the 36 beds are full of patients waiting for other rooms in the hospital.
Our staff have been amazing, but they are exhausted. They're taking care of patients that they have not specifically trained to care for. They're providing exceptional care, but many of us have been pushed way outside of our comfort zones.
And that is why Billings Clinic is now moving toward crisis standards of care.
This does mean the possibility of making difficult choices. It does mean that we might not always be able to deliver the same standard of care that we normally would to all patients.
Allen is one of the only healthcare ethics consultants in the state and says the framework used by Billings Clinic was created statewide and has been endorsed by both the current and past governors.
We're putting in place processes to, if we have to make those incredibly difficult decisions, we're prepared to do that in an equitable, non-discriminatory, fair, and consistent way.
The clinic will likely start implementing crisis standards within a week or so.
This can include choices of which of this number of patients is able to get the highest level of care, the best chance at survival. But it's about many, many, many smaller choices before we get to that point.
And in the meantime, to avoid reaching that point, Allen says the rest of the community can help.
By getting vaccinated as soon as they can, by wearing their mask, by quarantining if they're infected or otherwise. And that's a sacrifice that people make, but it's a sacrifice that can benefit the health of everyone in our community.
In Billings, Janelle Slade, MTN News.